What you don't know they didn't tell you about long COVID. Welcome to Vitality Vortex channel, your go-to destination for all things health, wellness, and natural remedies. Today we're diving into a topic that's impacting individuals worldwide. Long COVID, also known as post-acute sequelae of SARS-CoV-2 infection, PASC. It has emerged as a significant concern amidst the ongoing COVID-19 pandemic. It refers to the persistent or recurring symptom experienced by individuals even after their initial bout of COVID-19 has resolved. While the acute phase of COVID-19 primarily affects the respiratory system, long COVID can affect multiple organ systems and present with a wide range of symptoms. Initially termed long haulers by those grappling with its effects, long COVID encompasses a broad spectrum of symptoms that can persist well beyond the resolution of the acute infection. While respiratory symptoms like coughing and shortness of breath are common during the acute phase, long COVID may manifest in a plethora of ways, affecting not only the respiratory system, but also the cardiovascular, neurological, gastrointestinal, and other bodily systems. Before we continue exploring long COVID, don't forget to like, share, and subscribe to Vitality Vortex for more insightful content on health, wellness, and natural remedies. Hit that subscribe button and turn on notifications so you never miss an update. Let's continue our journey together towards optimal health and well-being. One of the challenges in understanding long COVID lies in its variability and unpredictability. Symptoms can vary widely from person to person, both in terms of severity and duration. While some individuals may experience mild symptoms that resolve relatively quickly, others may suffer from debilitating symptoms that persist for months or even longer. This variability makes it difficult to establish a standardized definition of long COVID, as symptoms can manifest differently in different individuals. I have patients in urgent care that tells me, "I never felt the same since I got COVID. I felt like I am always tired." The symptoms of long COVID are diverse and can affect virtually any part of the body. Common symptoms include persistent fatigue, shortness of breath, chest pain, joint pain, muscle weakness, cognitive dysfunction, often referred to as brain fog, headaches, and sleep disturbances. Additionally, individuals with long COVID may experience symptoms such as heart palpitations, gastrointestinal issues, skin rashes, and mood changes. The wide-ranging nature of these symptoms underscores the complex and multifaceted nature of long COVID. The exact mechanisms underlying long COVID are still not fully understood. It is believed that the persistence of symptoms may be related to a combination of factors, including viral persistence, immune dysregulation, inflammation, and tissue damage. However, more research is needed to elucidate the underlying mechanisms and identify potential targets for treatment. Despite significant strides in understanding long COVID, its exact mechanisms remain elusive. Current research suggests that the persistence of symptoms may stem from a complex interplay of various factors, each contributing to the chronic nature of the condition. Viral persistence is one potential factor implicated in long COVID. While the acute phase of COVID-19 typically lasts a few weeks, the virus may linger in the body for an extended period, triggering ongoing immune responses and inflammation. Persistent viral activity could perpetuate symptoms even after the initial infection has resolved. Immune dysregulation is another key aspect thought to play a role in long COVID. Following the acute phase of infection, the immune system may continue to be activated or dysregulated, leading to prolonged inflammation and tissue damage. Dysfunctional immune responses may also result in autoimmune reactions, where the body's immune system mistakenly attacks its tissues, exacerbating symptoms. Inflammation is a hallmark feature of COVID-19 and is believed to contribute to the pathogenesis of long COVID. Chronic inflammation, triggered by persistent viral activity or dysregulated immune responses, can damage tissues and organs throughout the body, leading to a wide range of symptoms. Additionally, inflammatory cytokines, released during the acute phase of infection, may continue to exert their effects in the post-acute phase, perpetuating symptoms. Tissue damage incurred during the acute phase of COVID-19 may also contribute to long COVID. The virus can cause direct damage to various organs, including the lungs, heart, brain, and blood vessels. This damage may persist or worsen over time, leading to ongoing symptoms and functional impairments. How to diagnose long COVID? Diagnosing long COVID can be challenging and requires a comprehensive and multidisciplinary approach, integrating clinical evaluation, medical history, physical examination, laboratory tests, imaging studies, and specialist consultation as needed. While there are no specific diagnostic tests for long COVID, a thorough assessment of symptoms and potential contributing factors is essential in arriving at an accurate diagnosis and formulating an appropriate treatment plan for affected individuals. Medical history. A detailed medical history is crucial in diagnosing long COVID. Patients are typically asked about their COVID-19 infection history, including the onset and duration of symptoms, severity of the acute illness, any hospitalizations or complications, and the course of recovery post-infection. Understanding the timeline of symptoms and their progression is essential in identifying potential cases of long COVID. Physical examination. A thorough physical examination is conducted to assess the patient's overall health and identify any signs or symptoms indicative of long COVID. This may include assessing vital signs, examining the respiratory, cardiovascular, neurological, and musculoskeletal systems, and evaluating for any physical manifestations of long COVID-related symptoms. Symptom assessment. Healthcare providers evaluate the presence and severity of symptoms commonly associated with long COVID, such as fatigue, shortness of breath, cognitive dysfunction, chest pain, joint pain, and other persistent symptoms. Patients may be asked to complete standardized questionnaires or symptom scales to quantify the severity and impact of their symptoms on daily functioning. Laboratory tests. While there are no specific laboratory tests for diagnosing long COVID, healthcare providers may perform a range of blood tests to assess for underlying abnormalities or conditions that could contribute to the patient's symptoms. These may include complete blood count, CBC, inflammatory markers, such as C-reactive protein, or erythrocyte sedimentation rate, markers of organ function, such as liver and kidney function tests, and tests to evaluate for autoimmune or inflammatory conditions. Imaging studies. Imaging studies such as chest X-rays or computed tomography, CT scans, may be performed to assess for any structural abnormalities or damage to the lungs, heart, or other organs that could be contributing to the patient's symptoms. Imaging findings may help rule out other potential causes of the symptoms and provide additional insight into the underlying pathology of long COVID. Specialist consultation. In some cases, healthcare providers may refer patients to specialists such as pulmonologists, cardiologists, neurologists, or rheumatologists for further evaluation and management of specific symptoms or complications associated with long COVID. How to manage long COVID. Managing long COVID requires a comprehensive and holistic approach aimed at alleviating symptoms, improving quality of life, and promoting recovery. Given the diverse array of symptoms and their varying impact on individuals, management strategies need to be tailored to address the specific needs and challenges of each patient. Medications. Pharmacological interventions may be used to target specific symptoms experienced by individuals with long COVID. For example, Pain relievers or anti-inflammatory medications may be prescribed to alleviate musculoskeletal pain or inflammation. Antidepressants or anxiolytics may be recommended to address mood disturbances or anxiety symptoms. Additionally, medications to manage cardiovascular symptoms, such as beta blockers or anticoagulants, may be prescribed as needed. Physical therapy. Physical therapy plays a crucial role in addressing musculoskeletal symptoms, improving mobility, and enhancing overall physical function in individuals with long COVID. Physical therapists design personalized exercise programs to target specific areas of weakness or dysfunction, incorporating a combination of stretching, strengthening, and aerobic exercises to promote recovery and rehabilitation. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy is an evidence-based psychological intervention that can help individuals with long COVID cope with cognitive symptoms, mood disturbances, and stress-related issues. CBT techniques aim to identify and modify maladaptive thoughts and behaviors, enhance coping skills, and promote adaptive strategies for managing symptoms and improving overall well-being. Lifestyle modifications. Lifestyle modifications are essential in managing long COVID and promoting recovery. This may include optimizing sleep hygiene practices to improve sleep quality and duration, adopting a balanced and nutritious diet to support immune function and overall health, and implementing stress reduction techniques, such as mindfulness meditation or relaxation exercises, to alleviate psychological symptoms and enhance resilience. Supportive care. Supportive care measures are integral to managing long COVID and facilitating recovery. Adequate rest and relaxation are crucial for conserving energy and promoting healing. Hydration is essential for maintaining hydration status and supporting bodily functions. Nutritional support, including a well-balanced diet rich in vitamins, minerals, and antioxidants, helps support immune function and overall health. Multidisciplinary collaboration. Given the complex and multifaceted nature of long COVID, a multidisciplinary approach involving collaboration between healthcare providers from various specialties is essential. This may include primary care physicians, specialists, such as pulmonologists, cardiologists, neurologists, and psychologists, physical therapists, occupational therapists, dietitians, and other allied health professionals, working together to address the diverse needs of individuals with long COVID. In conclusion, long COVID represents a complex and challenging condition that continues to pose significant clinical and public health implications. As our understanding of long COVID evolves, it is essential to prioritize research efforts aimed at elucidating its underlying mechanisms and developing effective treatments. By addressing the long-term effects of COVID-19, including long COVID, we can better support affected individuals and mitigate the long-term impact of the pandemic on global health and well-being. Thanks for joining us on this exploration of long COVID. Please share your comments below if you have experienced these symptoms after having COVID infection. If you found this information helpful, be sure to subscribe to Vitality Vortex for more valuable insights on health, wellness, and natural remedies. Click on the playlist or browse our channel to discover a wealth of information on various health topics. Keep learning, stay informed, and take charge of your well-being with Vitality Vortex. Until next time, stay well.